refer to it later as OPT. UNRWA is committed to OPT, seeking to prevent UNRWA from delivering services. Since the ceasefire started on the 19th of January, so just over 10 days ago, UNRWA brought in 60% of all aid supplies that went into Gaza, and our teams continue to distribute. So it's not just about bringing in the trucks, it's also about the reach and the distribution of aid. We were able also to do that in northern Gaza, where, according to estimates, hundreds of thousands of people have gone back to. So that's one thing. And yes, if UNRWA's work is interrupted, if UNRWA is not allowed to continue to bring and distribute supplies, then the fate of this very fragile ceasefire is going to be in the risk and is going to be in jeopardy. Palestine refugees will continue to depend on UNRWA across the occupied Palestinian territory, and I'll refer to it later as OPT. UNRWA is committed to continue delivering life-saving and other basic services. That includes the Gaza Strip and the West Bank, including East Jerusalem, a full implementation of the Knesset laws across the OPT, seeking to prevent UNRWA from delivering services, will have catastrophic consequences on the lives and futures of Palestine refugees. In the Gaza Strip and in the West Bank, they face an exception.
To confirm that indeed, over the 15 months into the conflict, we were...
UNRWA international staff posted in East Jerusalem who have been granted limited visa duration. Their visas expired on the 29th of January. These visas issued by the Israeli authorities. They had no alternative but to leave that territory under protest. Our remaining Palestinian colleagues, both in the Gaza Strip and in the West Bank, they face an exceptionally hostile environment as a fierce disinformation campaign against UNRWA continues.
Partly functional. The ceasefire is, and that's good news, allowing scale of aid. On health, of course, still being shown. And as we all know, the health needs...
Medical evacuations. They must urgently resume, and the medical corridor must open now. So currently we estimate that between 12 and 14,000 people need medical evacuation. Among these, let's say for the early trenches, we estimate that there's roughly 2,500 children in need for urgent medevac outside Gaza. So what we have been asking for all the time, but should really happen now, is first and foremost a restoration of the referrals, the traditional referral pathway to West Bank and East Jerusalem.
In Gaza, and currently there's only 10 partially functional hospitals in Gaza City and one minimal functional hospital in North Gaza.
That the first medical evacuation since the ceasefire is expected. We hope it will happen. We will report on it tomorrow via Rafah for an approximately 50 patients. But if we continue with this pace, which we've been having now since the Rafah border closed, like that, then we will be medevacing for the next 5 to 10 years. This needs to change.
The North delivered yesterday dignity kits to support our psychological support, expansion of Shifa Hospital by 200 beds.